I'm Dr. Hayes, and I wanted to talk to you a little bit today about how we have been very successful at our clinic and the methods in treating carpal tunnel syndrome. Most people don't realize that chiropractic is uniquely suited to treat carpal tunnel because in addition to addressing any issues with the wrist, we also want to make sure that we address any issues that happen with the neck. Now, due to the modern conveniences such as the computer and the increase in games played on a TV set, we've noticed an amazing increase in carpal tunnel. The damage done is not only at the wrist by constant pounding and use of the keyboard and the mouse, but also with the gaming instruments that the young people use. However, what's often overlooked is damage to the neck due to the constant straining towards the computer screen or straining towards the television set. Now, when you strain your neck and aggravate it, you're going to aggravate the nerves in your neck, and these nerves form the brachial plexus, which is a large group of nerves which will travel underneath the collarbone and then go down the arm, ending at the hand but flowing through the carpal tunnel, which is right about where my pinky is. Now, when someone has surgery for carpal tunnel syndrome, they will come in and cut the flexor retinaculum, which will relieve pressure on that area. One of the big reasons that this fails is that as the surgery heals, the scar tissue that's left from the surgery makes the carpal tunnel thicker, which again will compress the median nerve, resulting in the same or worse symptoms. The other problem with the surgical approach is that the neck area is not addressed. So if you have a problem upstream that's causing a problem downstream, you don't address that, you're going to have surgery and still have the same problem. So both areas need to be addressed. When we have someone who comes into our clinic, of course we assess their neck. Typically the treatment that we have had great success with here is the Cox flexion distraction technique, which is, as I said, a flexion distraction technique which is much like traction, only it's controlled by me. The patient is pretty comfortable. Most people really enjoy it, but more importantly they get great relief from it. They can sometimes immediately feel the pressure in their neck released and feel a change in their wrist. Now we're going to take a quick jog down to our therapy area and show you the other methods we use in our successful treatment of carpal tunnel syndrome.